This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, it seems like every single disease has its own color. With breast cancer, you always see pink ribbons, ovarian cancer, teal, pancreatic cancer, purple.
But do you know why the lung cancer ribbon is white? Well, white can be hard to see, just like the symptoms of lung cancer, and it makes sense because it's the deadliest cancer there is. In many cases, by the time it's detected, it's already spread throughout the body. Lung cancer are two words that changed Dina Cook's life, and now you are advocating to spread awareness. Brenda Martin, who is the coordinator of PRMC's Lung Cancer Services program, also joined us. Thank you both for joining us today.
Our pleasure. Thank you.
Dina, 2012.
Yes.
Take us back.
Actually, we're going to start a little earlier,
Okay.
fall of 2011. I had a bad cold. Went to the doctor. My primary care physician gave me an antibiotic, which cured my cough, but he also sent me for a chest x-ray just to make sure I didn't have pneumonia. And from that chest x-ray, things started. They found some nodules. We're not sure what it was, but started to follow me and eventually led to surgery in July of 2012, where they removed a small nodule that was cancerous in my lower left lobe, so they removed my lower left lobe.
Wow.
So had really no symptoms. I was just extremely lucky that my primary care doctor sent me for a chest x-ray.
Would you have ever thought that going to the doctor for a simple cold would lead to something so serious?
Absolutely not. No.
Yeah.
And like I said, I was lucky because I'm one of the 15% of lung cancer patients that was diagnosed before the disease had spread. So they found it very early, and that's the best thing we have going for this disease at this point in time is to find it early.
And your prognosis, I understand you just got some news?
I just had my 6-month CT in October, and everything is stable. So
wonderful.
Stable is wonderful.
Congratulations.
So, yes.
You know, it's
Thank you.
interesting because unfortunately, the first thing people think of when they hear that somebody has lung cancer is, oh, they must have been a smoker.
Right. The stigma is adversely affecting the research funding and the discovery, actually, of lung cancer. Not to mention how it affects a patient when the first words out of somebody's mouth when you say, I have lung cancer, I've been diagnosed with lung cancer, is if they ask you if you smoked, which places blame. You know, whether the person smoked or not, they should never be asked that question. And the underlying facts are, if you have lungs, you can get lung cancer. 20% of people that are diagnosed with lung cancer have never smoked. And that's a lot of people, considering the numbers of people that are diagnosed. 21,000 women will be diagnosed this year with lung cancer, and they never smoked at all. That's a lot of people.
It is.
So we have to get rid of the association that you automatically got lung cancer because you smoked. I don't propose smoking. It is bad for your health. You can get lung cancer, you can have a heart attack, you can get, you know, diabetes. It's a bad habit, but that's not the end all for lung cancer, and we need to end that stigma so we can move forward and save lives.
So there's something better to say.
Yeah.
Starting
I'm
out.
sorry.
There you go.
Can I help you?
Yeah.
Any diagnosis with cancer is dramatic. Don't add to it by asking that question.
But, you know, and as you said, you know, smoking is bad for your health. That's a known fact. And, you know, that's one of the things that is attributed to smoking. Is that right, Brenda?
That's right, that's right. And, you know, lung cancer is a devastating disease. We know that. And we know it's the leading cause of cancer death in the United States. It actually causes more deaths than breast, colon, and prostate cancer combined. And as you've alluded to, part of the reason for this is that it's often diagnosed late when the cancer has advanced and the treatment isn't successful. because lung cancer, when it's early, is often asymptomatic, no symptoms. So it's usually not until people have symptoms like a persistent cough, change in their breathing, pain in the chest, then they go to their provider, and then if the lung cancer is diagnosed, it may be too late. But we do have good news. We now have a screening test for lung cancer that we're very excited about. You know, for a long time we've had mammograms and colonoscopies and pap smears to screen for other cancers, but lung cancer, in part because we haven't had as much research, has lagged behind in that. But we're very happy, you know, to know that we now have a screening test for lung cancer. It's called a low-dose CT scan. And this came about because of a big national research trial where CT scan was compared to chest x-ray in groups of people who were smokers or former smokers. And low-dose CT scan was found to decrease the lung cancer death rate by 20%. So it was able to find the lung cancer earlier and enable people to have treatment at an early stage when it's successful. Right. So we want to have more folks like Dina, you know, who are diagnosed early, right. Who have successful treatment. So we do have, I'm sorry?
There are criteria?
There are criteria. Not everyone is eligible. Anyone can get lung cancer. However, Medicare and most major insurers do cover the screening, but you have to meet certain criteria.
Okay.
That is, you have to be between the ages of 55 and 77. Mm-hmm. You have to be a current smoker or have quit in the last 15 years. Okay. And you have to have a smoking history of at least 30 pack years. And pack years is a way that we quantify how much smoking you have done. So that means the number of packs per day that you smoked multiplied by the number of years that you smoked. So for instance, if you smoke 2 packs a day for 20 years, you have a 40-pack year history.
Oh, okay, gotcha, I understand. Mm-hmm. All right. Okay. And we also had a phone number on there for you to call.
Yes, yes. If you have questions about the screening, if you're not sure if you're eligible, if you'd just like to talk about it, you can call me at Peninsula Regional, and that's 410-543-7551.
And Dina, there's an upcoming event. Yes. It's called Shine a Light on Lung Cancer. What is that?
Well, this will be our 3rd event that we've held with the Lung Cancer Association and the PRMC to honor those that have been impacted by lung cancer, whether you're a survivor, whether you had a loved one that you lost to lung cancer. This is an evening to bring awareness to this disease and come together in a positive, hopeful way that we can change things and improve outcomes. It's going to be at the center at Salisbury, out in front of Boscov's by the stage area. Mm-hmm. It'll be on Wednesday, the 2nd of November at 6 o'clock, and we would love to see everybody come out and join us. Brenda will be there. One of the focuses this year will be on the CT, the low-dose CT screening, because that's important information that people need to have if they are at risk. Right. And we want everybody, as Brenda said, to be lucky like me, mm-hmm. and get the disease. If you have, have it going on, get it early, because your chances are much greater.
And we want to show a picture, and I'm sure this is motivation for you.
Yes.
This is why your good news is even better.
Yes. We are blessed with 8 grandchildren, 7 granddaughters and 1 grandson, and we owe it to my children and our grandchildren to get a handle on this disease, and to improve the outcomes, because too many people are dying from lung cancer every year, and it's changed. We're getting out there. I read once that lung cancer is unnoticed, undetected, and unspoken. And we're going to change that.
Change that.
Yes, we are.
Okay, now I usually don't ask a question like this, but I understand there's something you want to show us.
Oh, yes. Our youngest daughter, to bring awareness to this disease, got a tattoo, which touched me, and it had the white ribbon on it, or actually it's the ribbon that you can't see. Right. And then my other daughter got a tattoo on her neck that had Mom and the ribbon, and I thought, if they've done this, I need to do it as well. So At the age of 65, I got tatted.
Oh, look at you.
With my daughter. We were there together. And the ribbon is clear because that's the ribbon for lung cancer.
Yeah.
I wear pearls for lung cancer. But we need to take this disease out of the shadows and talk about it. There's nothing to be ashamed about. It's a disease that needs attention and research and improvement. And we're going to do it.
We're going to do it. Dina, Brenda, thank you so much for coming in and talking about this and shining a light on lung cancer. Make sure you go to that if you want to read more from PRMC about lung cancer or for more information on the screening we discussed or the Shine a Light on Lung Cancer event, go to our website, delmarvalife.com.